Hi friends, this is Dr. Abdequaem Chimthanawala. Once again, we meet for a YouTube live session on a very interesting topic, different ways of prescribing. I've completed about I think 6 to 7 ways of prescribing, and I hope you must have liked that because there were a lot of inquiries, lot of queries on my WhatsApp, on my Facebook page. Last time we somehow completed, I think, on the face, prescribing through face. So this time I'll change the topic and I'll move forward. I'll tell something how to prescribe by just seeing the skin of the patient. Skin, a very important organ of the body, stretched from the head to the toe. That's what is important to understand and see the skin and be able to prescribe. Skin is such an important part in our mathematical or prescribing. We see just by touching the skin, just by seeing at the skin, just by looking at the quality of skin, you can at least get to the a group of remedies. Or sometimes if you have 3 4 remedies on the repertory chart, if the skin is very peculiar of that patient, you can see and then prescribe. So this is very important to understand skin, and it can be from the scalp to the toes, abdomen, anywhere in the body. So by the time people I hope people join in early, because I always tell, if you join early, I can start early, and you are not lost in the world where what I am talking you can't understand. That should not happen. So as always, people are joining now, and YouTube live is only half an hour. So the early you are prepared, the better for me. If you have still come, just say a hi so that I can start speaking. First of all, yeah, Dr. Bangi, walaikum assalam. So just tell me, first of all, have you ever seen different type of skin, or have you ever prescribed on looking at the skin of the patient? Any experience you have on looking at the skin of the patient? Anybody? People have joined in now. Have you ever seen how to prescribe on skin? Of course, don't tell me the skin of sepia, like saddle on the face. Something very peculiar, as I told, something about the face, the haggard look, the powdery lips, the scaly lips, the cheeks, the chubby cheeks, or the pinched chin. Something very particular about the skin, or the wrinkled forehead I told you, or the knitted brows, eyebrows. So there has to be something very particular to the skin which will guide you to the remedy. As you always will agree that there are different approaches now to prescribe, and when you take a perfect case, you take a very nice case, but still when you prescribe, you are not sure that the remedy will work or not, because you have failed to prescribe on the PQRS symptom. So if you have got a set of remedies, if you know the face of the remedy, the skin of the remedy, the eyes of the remedy, ask some questions and see whether that remedy matches, and then prescribe. So in my experience, whatever I have seen in my clinic, see, looking at the skin of the patient, I have seen there are different types of skin which you should be able to understand and interpret. For example, everybody will appreciate called as filthy skin. Filthy skin. Now, filthy skin, there are a lot of remedies. Filthy skin. For example, you tell me some examples of filthy skin. Of course, you know sulfur, very filthy skin, or remedies like soranum have filthy skin. Any more remedies that come to your mind which has a very filthy skin, a very dirty skin, and you have prescribed the remedy? I'll just tell you my experiences of what I have seen in filthy skin. So the first remedy that you should remember for filthy skin is, of course, one of the greatest antisoric, one of the best antisoric, that is sulfur. So you have to remember sulfur. Second, soranum. Third, I have seen Apis mellifica, arsenic album, and one of the very rare remedies called as sanicula. I have seen sanicula have a very important skin symptoms. Of course, as I go further, and if I get time, I'll tell you how to see sanicular skin. But yes, Dr. Shoaib has come, Dr. Panjwa is there. Uh, so this is basically, yeah, Dr. Weber, hello. Dr. Bangi says calcareous. So these 5-6 remedies do think about skin remedies, and there are very peculiar symptoms about sulfur skin, epismel skin, arsenic skin. If I get time, I'll differentiate different types of skin symptoms of sulfur, maybe arsenic, maybe rust ox. And it's a very interesting skin differentiation because for sulfur, we give sulfur so much that it's sometimes misused. Okay. Now, different types. Yeah, good evening, Dr. Sadhna. Different type, second type of skin I've seen, the patient has the skin becomes very मोटी चमड़ी बोलते हैं, the patient's skin becomes very thick after scratching, and which is the remedy that comes to your mind when the skin becomes very thick after scratching. Very, very important remedy. Skin becomes very thick after scratching. So if the skin is very thick after scratching, you have to think about, my friends, the first remedy, that is rust oxycodendron. Very thick skin, बड़ा मोटी चमड़ी का रहता है after scratching. Of course, we have then a very important remedy, ranunculus bulbosus, iodum, and dalcamara. Sometimes you have cracked skin. You know, cracked skin. You see the skin, and the skin is totally cracked. The cracked skin of joints, cracked skin of the palms, cracked skin of the soles, lot of areas, and there are different remedy for skin crackness. Sometimes the skin is very dry. Very dry. If you touch the patient's skin, it is very dry, and immediately you have to think about 2-3 remedies. Yeah, Dr. Mangi says income preferred is rest. So sometimes you see, you take the whole case, and I've told the patient to show the soles of the feet, and the soles of the skin of is very, very hard. I had a very, very interesting case, of abdominal tumor. The whole case was taken, and when I saw the soles of the patient, they were very hard soles. Okay, the sound is not good. Dr. Alexander, I'll share the sound is not proper. I'll share uh, the transparency, then you can see. So it's hardness of skin. So I gave that patient arsenic album, a very, very important remedy, and believe me, the tumor vanished. So this is how you have to basically understand skin. As you go further, there are different skins like I had a case where whenever the patient used to get stressed, whenever the patient got excited, there was horripilation, goose flesh skin. And whenever you get the symptom goose flesh skin, 2 or 3 remedies should come to your mind. The first remedy, very, very important remedy that should come to your mind is, actually the volume is low, just a minute. So, goose flesh skin, 2 or 3 remedies that should come to your mind is, now the audio is clear? So now the audio should be clear. I think now we are talking about goose skin, that is horripilation. The most important remedy that you should think about is jaborendi. If you have not thought, if you have, good evening, Dr. Meera. If you have not thought or not even given jaborendi for horripilation, you have missed the remedy. So think about jaborendi, think about causticum, very, very important remedies. Sometimes you have the discoloration, the chloasma in skin, very, very important skin, chloasma, or you have the skin is very inelastic. Dr. Sunal, welcome. Inelastic skin. So inelastic skin, you have to think about remedies like disease like Scleroderma. Very, very important remedies, Cuprum metallicum and Bovista. Of course, you must have oily skin. You have seen soft skin. There are sticky skins. So these are different types of skin which are very, very important to understand. So everybody, lots of people have joined in. I'll start now. I'll do some sharing of my slide. I do the slide so that everybody can understand and write down the notes if you want. And if time permits, I'll show the difference between different type of skin. For example, sulfur, maybe for example, rust ox, epismelific, arsenic, and other rare remedies where different type of skin indicates different types of remedies, and sometimes it is so peculiar that you can get the remedies very fast. So I hope the voice is clear now. I'll start sharing the slide. Slide sharing. So can you see the slide properly? Yes. Uh, so we have different type. As I have told you, you can write down filthy skin. Filthy skin, dirty skin. You have to remember remedies like sorinum, uh, Apis mellifica, arsenic album. Very, very important remedies. Now, everybody knows the skin of sulfur. Everybody knows the skin of sulfur. Let us see, or let us understand first of all what is the sulfur type of skin. Sulfur skin is so important. It is very important because most of the time it is misused. Most of the time, sulfur. And if you have seen sulfur skin, you can describe the sulfur skin by just by seeing a sulfur skin. A sulfur patient has a very, very typical indication of the skin. Can anybody tell me something very peculiar to sulfur skin? If you are prescribing, if you are prescribing for climatic period, if you are prescribing for menopausal period, and you have taken the whole case, but you are still confused what to prescribe, okay? And you just test the skin of the lady, and or the lady tells you the skin is always dry. It is not secondary dryness. It is not because of thyroid. So at climatic period, if the skin is dry and you are confused what to give, my dear doctors, my dear friends, always think about sulfur. Most of the cases, I repeat, most of the cases I have cured just by this symptom in menopausal age, dry skin in climatic period. Do remember this. And in sulfur, the urticaria is so severe, it is with the erosion of the skin of the toes. This is a sulfur urticaria. This look at for sulfur skin. And a sulfur patient always suffers from prickling. There is prickling in the skin. The patient will tell something is prickling. हिंदी में patient बोलेंगे ऐसा लग रहा है कोई सुई चुभ रहा मेरे चमड़ी में, and that is more when the patient is walking in open air. Then my friends, you have to think about sulfur. Very, very important entry points of sulfur skin that you have to remember today. I'm just giving you whatever comes to your mind, but these are symptoms which I've seen in my practice. Okay. Next, as I've told you, mice creeping under the skin. I had a very, very interesting case of uh, uterine fibroid, where after the case, the patient told, I feel as if the mice are basically running under the skin, and the remedy is sickle core. Thick skin after scratching. Always remember rustox, ranunculus bulbosus, iodum, and delcamara. In fact, I had told you before also in cases of herpes zoster, if you are confused what to give, then you must think first about ranunculus bulbosus, a very, very important remedy. Okay. Now this is very important. Veins plethoric network in the skin. This is a very, very important symptom of these remedies. Think about Crotalus horrides, carbo wedge, and causticum. You see the skin of the patient, and you can see the minute veins, the reddish, the bluish, the greenish veins on the skin anywhere in the body, and it is a very, very guiding symptom of Crotalus horrides, carbo wedge, and causticum. Of course, there are a lot of other symptoms you have to see, but this is how skin will guide you to the right remedy if you have group of remedies. I hope everybody is getting me what I mean to tell you. The slide is not clear. Okay. Next, you see cracked skin of the joints. If you have cracked skin of the joints, I know everybody knows about graphitis. that I've put. But the second remedy that you have to think about is hyposinium, a very, very important remedy called hyposinium. Has anybody used this remedy? It is a very, very important remedy. Hyposinium. Has anybody used this remedy? If you have used this remedy, it is very, very important to understand the skin symptom. Please go home and read this about this remedy. It is a very, very important remedy that you should know. Maybe the remedy is not so much used because it is not a polycrest and it is not being taught so much that that's why we fail to appreciate the symptoms of this remedy. Next, Kaliars, that is a very common remedy. Cracked skin of the palm, sister scan, petroleum and Morgan, a bowel nose fold. Sister scan, and now again a very, very important remedy. Yes, petroleum is also there, but sister scan for cracked skin of the hands, very, very important remedy. Dryness of the hands, parchment like. Dryness of the hands, parchment like. Brattacarp, anacardium and sulfur. I told you before two YouTube live, parchment like lips. I hope everybody remembers which is the remedy. Parchment like lips. Please do make notes so that you don't miss what I want to tell you. Parchment. This is basically brattacarp, anacardium and sulfur. Hardness of the skin of the soles. I just told you a case. Yeah, good evening, Dr. Rajesh Shukla. I just told you a case of a tumor in the abdomen where the patient, the soles of the skin were so hard. It was like, in the patient told me that it looks like an elephant skin. It is so hard. And that was a case of arsenic album which responded very nice to the treatment. The second remedy you should always remember for hardness of skin of soles, and that is antim crude. Again, a very, very important remedy, antim crude. I hope everybody is following what I mean to tell. I hope everybody is getting what I mean to tell. It is very important to have different approaches in your practice so that you are not stuck up. I always tell to my students, don't get stuck up because you cannot interpret a particular symptom. Move forward and see what the body is trying to tell us. Very, very important. I hope Dr. Meera and Dr. Shubham, Dr. Elisa, are you getting me what I want to tell you? That is very important for you. Don't get stuck up in one symptom and say that I cannot go further. So as you go further, we have talked about this type of skin, hardness of skin. Next, what I have seen, tightness of skin of fingers. Now this is a very, very important remedy. If you have never used this, the patient will come and tell you that the patient cannot stretch the fingers, or the patient, when he stretches the fingers, there is pain in the fingers, and most of the time we feel the patient is suffering from arthritis. But if you ask the symptom very delicately to the patient, he will tell you the skin feels as if stretched. The skin, if it feels stretched, then you have to remember, my dear friends, McFoss. This symptom you will see lots in your practice. That is McFoss skin. I have told you wrinkled skin of the forehead. Which is the remedy? I should show you a slide of the patient also. Wrinkled skin of the forehead. Which is the remedy? Anybody? Wrinkled skin of the forehead. Please do go home and read. Otherwise, my so many efforts, and if you cannot understand what is the use? Wrinkled skin of the forehead. There are a lot many of remedies I have told you. Stramonium, Dr. Meera says, yes, very nice. Any other remedies? We have stramonium, we have chamomilla, we have sepia, we have graphitis, we have cyclamen. If I can remember, why can't you remember? Read Matermedic every day. Yes, Dr. Shoaib, very nice. Now I give you, yeah, Viratram has some. So now I give you one more question. If there is a wrinkled skin, now here are my questions. If there is a wrinkled skin of the cervical region, you have seen in lot many of cases, just see the cervical region of the skin of the patient and it feels wrinkled. Have you seen this type of skin? Wrinkled skin of the cervical region. Just tell the patient to turn and see the skin of the cervical region and you will see it is wrinkled. Which is the remedy? I have taught so many cases using this remedy. Uh, in fact, this remedy is very important for urinary complaints and we are stuck up only thinking urinary complaints and we forget other symptoms. But if you have seen wrinkled skin of the cervical region, my dear friends, always think about sarsaparilla. I, if you have never heard about it, please do write in your Mater Medica. Next, I told you about horripilation, no? Goose flesh skin. Always remember these three remedies: jaborendi, sickle cornetum, and stickum. So, my dear friend, if you have not read jaborendi, please do think about jaborendi. I have got very fantastic results with jaborendi. Go and read this remedy. Don't always prescribe jaborendi for falling of hairs, white grayness of hairs, what is there in our patent. Don't give jaborendi for that. It has a lot other indications also. It's a very nice remedy. I have cured a lot of cases of using jaborendi in different type of disease pathologies. As you thick skin of the face. Yeah, Dr. Belwalkar says abrotenum. Yes. So thick skin of the face. Always remember belladonna and viola tricolor. It is not viola odorata. It is viola tricolor. Now, I had a case where the patient came and told me about. I think it was about 4 to 5 months back. He said, "I feel something." In Hindi, actually, first in Hindi he told me, ऐसा मुझे गुदगुदी यहाँ पे होती गुदगुदी गुदगुदी means the patient had this set type of gudgudi sensation, a ticklish sensation, tingling of the skin, tingling of the skin anywhere in the body. He feels as if somebody is tickling him. So tingling of the skin, my dear friends, a very important remedy. And which is that remedy? If you have tingling of the skin, you have to think about a wonderful remedy, and that is ozone. I know you must have heard about ozone. Anybody? Ozone. Has anybody heard about ozone? If you have, please say yes. If you not, please say no because otherwise we'll be wasting our time. Yes. So please do read something about ozone. Now, one patient came and told me that he feels that the skin of the nose is very tight. It's very tense. Which remedy comes to your mind? Which remedy comes to your mind? There is tightness of the skin of the nose. The nose, the patient feels it is very tight. He keeps pressing the nose in order to get relief. Tightness of the nose. Yes, doctor. Yeah, Mr. Weber has also read about the ozone. Yes. So when there is tightness of the skin of the nose, my dear friends, you have to think about a very important remedy, and that is phosphorus. First, phosphorus I have seen. If you have a case of phosphorus cured with your cured, you ask him something about the nose, and he will definitely tell you there is tightness feeling or the tension feeling in the skin of the nose. This is how you have to make your own materia medica, make your own entry point so that whenever you think about phosphorus, you have to have 3 or 4 striking features which you have seen in your previously cured cases and then apply that symptom on the patient and you will see very nice results. So tension in the skin of the nose, always remember phosphorus, petroleum, Aconite napellus. Very, very important remedies for tension of the skin of the nose. Have you ever heard about this symptom? If not, you must ask your patient. If you have prescribed the patient petroleum, just ask about the nose or touch his nose and you will see that type. So this is basically something about the skin. Of course, then you have lot of discoloration on the skin. If you open the Mater Medica, I always say it will be flooded with lots of discoloration of the skin. For example, you have blackhead discoloration, you have sometimes chloasma, you have green discoloration, blue, lot of discoloration on the skin. So I just share few of the remedies which I have got very good results in these type of complaints. And those remedies, first, when the discoloration of the skin is blackish type, these three remedies should strike you first: arsenic album, sickle core, and plumber metallicum. I must have cured lots of cases of gangrene where the skin is very blackish and other symptoms of arsenic album and sickle core. Very, very important when there is lot of what you call degeneration, blackish appearance of the skin, and that's how you have to think about arsenic album and sickle core. And a very, very important symptom that will come to OPD for chloasma. Chloasma, okay, a very, very irritating disease to treat. The results may vary from person to person. Of course, for chloasma, the first remedy you should think about is sepia. Second remedy, lycopodium. Now, one of the very, very important remedies that you should think about chloasma is, you have never heard or you must have heard this remedy for acidity, but a very, very important remedy for chloasma, and that is robina. Robina, yes, Dr. Shoaib Patel, Kalifas also. So, discoloration, chloasma. Please do think about robina because it is a very, very important remedy for chloasma. Lots of cases where I have given relief to the patient just by prescribing robina. So this is how you have to grow in your Mater Medica. This is how you have to grow in your practice. Whenever you have completed a case, just try to find out something peculiar, some rare symptom of a particular part of the body, and then you will see that you have developed your own Mater Medica, developed your own entry points to get to the remedy. For example, if the discoloration is in greenish spots, of course, if there's discoloration greenish and blackish spot, you can always think about arnica. But two remedies that should come to your mind for these complaints are buforana and conium maculatum. Very, very important remedies where the discoloration is in greenish spots. Have you ever come across this type of cases? This is all clinical Mater Medica. Clinically, what I have seen in my patients, I am sharing with you. There are a lot of skin symptoms in our Mater Medica, a lot of different types of skin in our Mater Medica that are present. But whatever I have got results with my remedy, I am just sharing that part with you. Okay. As I told you, Scleroderma, inelasticity of the skin. Very important remedies: Bovista, Cuprum metallicum, and Rust toxicotendron. In fact, I have few cases of Scleroderma, not cured, but much better with Bovista and Cuprum metallicum. With Bovista and Cuprum metallicum, of course, I always compare that with the mental symptoms of the remedy and I prescribe the remedy. But these two remedies have given me very good results in cases of Scleroderma. Sometimes you touch the hand of the patient and the skin appears very rough. Rough skin. Rough skin. So, rough skin. Which remedy it comes to your mind? Rough skin. Rough skin. Which remedy comes to your mind? Rough skin, which remedy comes to your mind? Yeah, green skin. If you ever heard about hypochromic anemia, was actually historically known as sclerosis or green sickness of the distant skin. So, rough skin we are talking about. Rough skin. Or for example, skin which has had lot of sun exposure. Age spots appear, and when that melanin becomes clumped, or it produces high concentration, and then also the skin becomes green. So Dr. Meera says carcinosin silicia, Dr. Bangi says sulfur, Dr. Sarit says alumina. So in my experience, what I have seen in my practice, rough skin. You have to remember these remedies, Dr. Meera, and sorry, yeah, calcarea, graphitis, petroleum, sepia, and sulfur. Oily skin, you all also know natramur, thuja, bryonia, china, and selenium. So rough skin. Touch the skin of the patient. Touch the skin of the patient, and you will see that the skin is rough. Exactly opposite. Exactly opposite. If the skin is very smooth, which are the remedies that you should think about? Very sorry, soft skin. Yes, Dr. Alexandra, Dr. Sarita, Dr. Meera. Exactly opposite to rough skin, soft skin. Whenever the patient has soft skin, just touch the patient. Soft skin, the first remedy that should come to your mind is silica. Silica, very important remedy. Thuja, very important remedy. And capsicum, very important remedy. Of course, this is what I have seen in my practice. And sometimes you touch your patient's skin, and it appears very sticky. It appears very sticky. Which remedy you should think when the skin is sticky in nature? Anybody? When the skin is sticky in nature. Dr. Meera, sticky nature. So Dr. Bangi says Kali bichrome. Can you think of something else? Sticky skin. Dr. Shoaib, Dr. Bangi. Anything more apart sticky? Now, I have seen and I have treated lots of cases with sticky skin having these type of symptoms. And the most important remedy that I have seen in my practice is phosphorus. See, I am only writing clinically what I have seen in my sticky skin. No, oily skin is a bit different than sticky skin. Next, my dear friends, my dear doctors, one important clinical tip. Whenever there is skin symptom with menses, which remedy you should think about? Dr. Meera. Whenever, yeah, Dr. Alexander says calcarea carb also can have sticky skin. So Dr. Meera or Dr. Alexandra, whenever it's an important clinical tip. Whenever there are skin symptoms with menses, you have taken the case, you are not getting results, take it from me. Try these remedies and you will definitely get this type of results. What remedy comes to your mind? Anybody? So, skin symptom with menses, which remedy comes to your mind? Anybody? Dr. Navjot says pulsatilla. Okay, anything more? Now you do write down at least two or three remedies for skin symptom. Dr. Mangi, I told you something about Kalikarv. You know, when I told you something about the face. Can you recall what happens in Kalikarv constitution at the time of menses? Dr. Bangi, I told you something about Kalikarv, which is I told you very important in to see Kalikarv. Dr. Alexander says magnum, Dr. Sarita says sepia. Now, the Kalikarv has a very important symptom with menses that I told you when I had shown you something about the face. That's why I keep telling you, read mathematics every day. YouTube live is only for half an hour. So please do join early. It's already half an hour over. Dr. Meera says Conium sepia macphos. I am telling you what is my experience on seeing this type of symptoms. Please do remember these remedies: graphitis, Dulcamara, and Natramure. Very, very important remedies for skin symptom during menses. Yeah, Sarasapar is also there. So this is basically skin symptom during menses. Yes. So Dr. Weber has a beautiful answer. Kalikarp face has a bloating face before menses or during menses. A very, very important symptom of Kalikarp. If you have bloating face, do think about Kalikarp. But if you have skin symptom with menses, do think about graphitis, Dulcamara, and Natramure. So, my dear friends, few questions if you have. It's already half an hour up. See, YouTube live is very short. By the time I start, I have to finish off. So please join early. Dr. Bangi says pimples, yeah, bloated face. So there is one type of skin, I'll tell you, I'll share with you, which have got very nice results, called as fish skin. Have you heard about fish skin? Anybody? Fish skin. What is that called as? Fish skin. What is a medical term that is called for that fish skin? Anybody? Dr. Bangi says no. So in medical term, if you have this type of cases, I always tell you, you may have a lot of knowledge of Mater Medica, Repertory, Organon, but you have to be lucky to get patients also to apply the knowledge. So this is called as ichthyosis. Ichthyosis, yes, Dr. Bilwarkas is right. Ichthyosis, a very, very important skin condition. And let me tell you frankly, very, very difficult to cure. I have number of patients for ichthyosis of skin, they are better but not cured still. A very very bad type of skin. You cannot see it. It appears exactly like the skin of a fish. You touch that patient and you will feel disgusting, and you will not be able to touch the skin. Also, it is so dirty. It is fish type. So I called as fish type of skin ichthyosis. And one of the very important remedies that you should think about for ichthyosis is anybody that is thyroidinum. Very, very important remedies. If you're lucky to get this type of disease, think about thyroidinum. Think about syphilinum. Very, very important remedies. Thyroidinum, syphilinum are a very, very acute remedy that you must have thought in your practice, maybe used a lot of times. That is hydrocotyle. Hydrocotyle. Have you ever seen the skin of hydrocotyle? Hydrocotyle. Hydrocotyle skin is such an important skin. Hydrocotyle. Uh, I remember because I have a lot of cases uh, much better by using hydrocotyle. So the most important symptom of hydrocotyle is it produces excessive thickening, hypertrophy, and induration of the skin. My dear doctors, write down this symptom. You have to see this symptom in hydrocotyle in order to understand. It produces thickening, hypertrophy, and induration of the skin. And there is intolerable itching with marked exfoliation. A typical wording of fish skin exactly matches to the symptoms of hydrocotyle. And in hydrocotyle, the eruptions are always copper colored. So this is how you have to see the skin of the patient and be able to prescribe. So just a short introduction on entry through skin. I'll definitely go further and tell you something more about the skin. But today, have you understood hydrocotyle skin? Anybody? Have you understood hydrocotyle skin? Write down. It produces thickening, hypertrophy, and induration of skin. First, intolerable itching with marked exfoliation, copper colored eruption. This is a typical skin of hydrocotyle. A very, very important remedy for skin condition. Of course, there may be a lot of skin symptoms in hydrocotyle, but these are the most important symptoms that I have seen and prescribed in case of hydrocotyle. Yes. So in short, it's already 5:10. We are 10 minutes up. In short, this was a slight introduction of skin symptoms of what I have seen in my practice and be able to prescribe. Yeah, Dr. Balwalkar has seen thick skin. Of thick skin is something different and fish skin is something different. So, my dear friends, if you have few questions, we are ready for it. Be, be sure that be sure that YouTube live is only for half an hour. So please join in early and try to be very alert because few symptoms here and there and you miss the whole story of what we are sharing. So this is in short something about hydrocotyle. Yeah, so to Dr. Alexander, thank you so much. In future, just a request to please join in 5 minutes early so that I can complete what I will need to tell you, and then you can have floods of questions, and I'll try to answer whatever I've seen in my practice. So everybody, it's already 5:10, and thank you for joining, and thank you for spending your valuable time with me. Meet you next on Wednesday, 4 o'clock on Facebook Live for live question answer session. Thank you.